Hello, my name's Bran Morse and this is my story about my back injury and how I got dependent on painkillers. October 2009, I lifted something in work and a couple of days later I could barely move. As time went on, I went to the doctors and I was prescribed painkillers, which helped but just masked the pain. I was then diagnosed with a prolapsed disc. And as time went on, the pain got worse. Worked up until December 2010, but then it got too much because I wasn't really able to walk very far. Then later that year I became incontinent and was actually on crutches with TENS machine and various other bits. First time I met Dr. Jeffs was when I was a patient in County Hospital, and she was keeping track of the medication and reviewing it. I was a patient of hers within the pain management team, and I saw her team as on a one-to-one basis. First of all, seeing the psychologist and the physio. My sessions, I was actually in bed. It took a lot out of me to actually be able to come to the sessions and the appointments, but it was something I knew I had to do. Somewhere along the line, can't really remember timescales, but I was diagnosed with an extra vertebra, so all the pain medication and pain relief injections weren't actually working because I had the extra vertebra. I was on a huge cocktail of medication. I think it was a total of something like 40-something tablets a day. After the 6-month stay in hospital, I returned home, still on the huge cocktail, and spent another year in bed prior to having some surgery. I had to have a stair lift fitted, had to have an extra handrail, had to have the bathroom converted to a walk-in shower with a seat, and we actually had to have the bed downstairs for a long time prior to having the stair lift fitted. So I spent nearly 2 years with a bedroom downstairs. After my surgery, I started to see Dr. Jeffs and her team. Dr. Jeffs took me under her wing and I was having individual sessions with her. And we worked together to build up my self-esteem and my confidence to be able to go into a room with other patients and work going to pain management actually gave me the insight into what pain has, the way pain has an effect on the body, the science behind it, the understanding of what happens when the pain cycle begins, and it just gave me the strength and determination to move forward, to be able to very slowly, with the guidance of Dr. Jeffs, wean off the medication. It wasn't easy. There was a lot of side effects coming off the medication, and it's not something you can do quickly. It has to be managed, it has to be done slowly, and it has to be done with support of not just professionals but family. My pain is very different because I don't have pain anymore. My surgery has done the job, so I no longer needed the medication, but at the time I didn't know that I didn't need the medication. When I started walking again, it was very surreal. It was something I never thought I would do. And the first day I walked after my surgery was probably the most overwhelming thing I've ever been through in my life. It was surreal to think that I'd been bedbound for approximately 5 years, or, well, between a bed, wheelchair, crutches. I hadn't been independent for all that time. We now have a regular house with no adaptations. So I've had a bath refitted because I like to have a soak. So the walk-in shower's gone, the stair lift's gone, everything's gone. And my bedroom's back upstairs. Life is different because I'm now the proud mum of 2 babies that me and my husband have adopted. So for somebody that had a 1% chance of walking again, I think that's quite an achievement, really. So to anybody who's on a lot of pain relief, and you feel that you're not in control and you want to take that control back, then seek the advice, get the help, ask the question. There's such a large chunk that I don't remember. I was existing. Now I'm living. So I've got my life back.